We come into picture when the traditional treatment has failed or the patient doesn't want to go for this traditional treatment anymore, which means they don't want to save the tooth through root canal or a crown and all that. They're also looking for a little bit of a more cosmetic smile. Implants is something which has become a very promising treatment because the implants cannot get decay. Although they can get gum disease, they cannot get cavities. So it becomes a permanent solution for the patient. The biggest thing I will tell a patient is that all the treatment that was done was to do with the teeth. That's vulnerable to, like bacteria and all this stuff. Now it's titanium which is going to be in their mouth. So bacteria cannot eat the titanium, they cannot cause cavities. Besides that, you see, like, I'm not a dentist who does implants and cleaning and filling the root canals. I only do implants. My whole career is devoted to implantology. So we know this job very, very well. We put patient to sleep for patients who are anxious, fearful. We have like a lot of patients that we have done that you can see before after pictures, and you can even talk to them. This is what we do every day. Our work is not average, it's above average. We produce exclusive work. We stand behind the work we do. As you can see, we have technicians on site, we have CNC machines, we have lab. So everything is under one roof. If something were to break, I can fix it same day. I have the design file in the computer. I can mill it the same time, same day. So you are very well taken care of. And I'm not here on a salary. You see, like, I own this practice. We are 2 full-time doctors here. We are open Monday to Saturday. We're always working. The office is open all the time. The technicians here until like 2 o'clock in the night. So we are here, so we can take care of if anything goes wrong. We love our job. We're very passionate about it. You are in the best hands. All on 4 or all on X treatment is the treatment done when you are not saving any teeth in the mouth, or at least in one jaw, right? The word all comes, we replace all the teeth in that arch, in that jaw. That's where this word all comes from. All the teeth are being replaced. Now these teeth, it's a one-piece bridge that's placed in your mouth. It can either sit on 4 legs or 6 legs or 8 legs, like a chair with 4 legs, chair with 8 legs, chair with 6 legs. The way God gave this system is that the front teeth are to make a bite in the apple, and that chunk that goes in is transported back to the back teeth by the tongue, and that's where the real chewing happens with the back molar teeth. The 4 implant option really started with the nursing home patients. When this was discovered that titanium can bond to the bone and be accepted, and not rejected as a foreign body. So Dr. Forgot his name, he was an orthopedic surgeon. He discovered this phenomenon, and he said where he can use this for humanity. So to him, the place was nursing home, where patients have these loose dentures and all their life they've been suffering. Everything has been taken away. They can't eat. So he went there and saw where the bone was. So those patients, they have all the bone dissolved away. The only bone left was under the nose and the chin. In those areas, they wanted to at least put 4 implants. So 2 here, 1 here, 1 here, and in the chin area, 4 implants. So this is how the 4 implant treatment started with nursing home patients. They will give them a one-piece bridge on those 4 implants, and they will just hang a chewing tooth in the back. And these patients, like nursing home patients, even this was a big improvement for them. But the problem is this, that now they have brought this treatment, which is the older patients, to younger and younger patients who have many, many more years to live. The front implants give you smiling teeth and maybe biting teeth in the apple. They don't give you chewing teeth. So since you're so young, we don't want to give you that treatment, the treatment of nursing home patients too. So we want to add at least 5th or 6th or even 7th and 8th implant. So 5th and the 6th implant will give you 1 set of molar supported, and the 7th and 8th implant will give you 2 sets of molars. So with 8 implant option, I'm able to give you all the teeth except the wisdom teeth. One other reason who this treatment is for, the younger you are, the more we worry about the treatment has to last for a very, very long time. So I want to give you 8 implant option. Not only it gives you more mechanical support, more teeth and everything, but wherever the implant goes in the bone, that's where the bone remains alive and healthy. Implants produce health for the bone. Implant give exercise to the bone. The bone, which is osteoporotic and which has low density, once you place an implant in the bone, the life comes back to the bone. The body sends more oxygen, more mineral to that area once the implant is loaded. it maintains and makes your jawbone healthy. The biggest enemy of implantologists is that when you place an implant in the bone, 4% times the body rejects the implant. And it does not depend on the skill of the doctor. And I personally, clinically, what I've seen is that it really doesn't go along with you're a smoker, diabetic, all this stuff, right? It just happens. It's like by chance, by luck, right? So if this were to happen, I have covered it. Like chair with 8 legs, if one leg goes bad, you still have 7 left. Okay, so 2 ways implant fails. The first it fails is by rejection. That happens in the first month, or by wear and tear, where you got the implants, they passed the first test, they were all accepted, but later on in life, they got some bone loss and you haven't seen me for a long time, and now this implant has lost 50% bone, it remains red and pus and all this stuff. So we could remove that implant, but if I remove this implant, even then you have 7 legs of a chair, no new surgery, no new teeth. Even if everything goes against us, suppose you lose 1 implant in the beginning due to rejection, and second implant after 5 years because of wear and tear, bone loss, you still have 6 legs of a chair. So I'm giving a system which is mechanically sound, biologically sound, and it's really, really functional and also looks great. We are very particular about the job we produce. We don't produce mediocre work. Our work is really, really good. And if something breaks, we are able to take care of it. So we not only do the job, but we also maintain it. This chewing machine, it's a chewing machine. It's like, if you ask me, doctor, how long it's gonna last, I will tell you, just ask yourself, you bought a Mercedes car, how long this Mercedes car will last. Nothing is forever. Nothing is going to last forever, but it can last a long time if it's made well, if the car is made well, and if it's kept well. Okay, my job is to do a very good job, to give you a very robust job, and then your job is to keep it clean and keep coming every 6 months to maintain it. This way it can last a long, long, long time.